Hi everyone, my name is Michelle. I have been on a carnivore diet for the last 11 months, and I am right in the middle of my chemotherapy treatments to fight metastatic triple-negative breast cancer. Last week, I posted my chemo update number 7, and I had a comment from Karen Knight 9565 who suggested that I do a video about the process of the cancer diagnosis. Maybe this will be helpful to some people that might be facing this. So I have a timeline written out here, and I have some other materials that I will probably share with you as well. So let's get started. So on June 27th, I found a lump in my breast, and as I had been losing some weight and my body composition had been changing a little bit, I think it probably was there before, but had become a little more pronounced. And I found this lump. I could feel that it was hard, and it wasn't part of my normal anatomy. So the next day, which was June 28th, I called my doctor's office, my OBGYN, and they got me in the next day after that. So on June 29th, I had an exam. My OBGYN agreed that this was not part of my normal breast tissue and it needed a diagnostic mammogram. Now, the local hospital conglomerate, which is really in charge of almost all of the medical offices locally, which shall remain nameless, could not get me into their radiology department until July 19th, which was almost a month. And that was not acceptable to my doctor's office. So they called around, and the fourth place they called was a radiology center 45 minutes away from me. And they got me in on July 5th. So my diagnostic mammogram and ultrasound was July 5th. The radiologist spoke with me that day in person, said he would like me to come back for biopsies because there were some areas of concern in both breasts and both lymph nodes in the armpits. And so I went on July 13th for biopsies. Don't worry, there won't be a quiz on these dates. I just want to kind of outline it for you. So July 13th, I had the biopsies. There were 4 areas. There was one location in each breast and one location in each armpit for the lymph nodes. And total, I think there were 15 sections or punches for the biopsy. So they did several punches in each location. So that was July 13th. On July 18th, very early in the morning, my OBGYN called to tell me that the biopsies were positive for breast cancer and I needed to be referred to a surgeon. And so she gave me the surgeon's name and number, and I called and was able to see the surgeon on July 20th. On July 19th, the day in between, so the doctor called me on the 18th and told me that it was cancer. On the 19th, she had me come into the office to have my IUD removed. I had a Mirena hormone-releasing IUD, which is contraindicated to any kind of breast cancer, or any kind of cancer, really. They don't want that in your system because it can exacerbate cancer and even contribute to it. So that was removed on July 19th. On July 20th, I met with the surgeon and went in, had an exam first. I was there with my husband, and they brought us into a conference room. We met with the surgeon and her care team. There was a patient coordinator, a social worker, and a nurse. The patient coordinator was a social worker, I think, and then a nurse and the surgeon. And what we learned that day was that I was... obviously I had metastatic, triple negative, invasive ductal carcinoma, stage 3, grade 3. And so let's talk about what that means. And I'll show you, I'm going to show you a little bit of this big giant notebook that they gave me here. So I'm going to flip the camera around. So a couple of things here. This is the table of contents of the notebook that they gave me. And we're going to look at a couple of things. So we're going to look at the types of breast cancer and the pathology here. And then we'll look at my report. But this is just kind of general information. So the types of cancer we have here, this is invasive ductal. That's kind of what it looks like. And then if we look at I'll kind of zoom out on this page. So if anybody has any questions or you're going through something similar but have a different type of cancer, you can look at these descriptions in case your breast center is not as thorough in giving you information. But invasive ductal carcinoma is when the malignant cells in the milk duct have had the opportunity to break through the wall of the duct into the surrounding breast tissue. This is the most common type of breast cancer, accounting for 80% of invasive cancers. Invasive does not mean that the cancer has spread outside the breast, but metastatic does. And so that's that. And then 3, this is the pathology. So the size of my tumor was 2 to 3 centimeters. They're calling it a grade 2 to 3. And they actually said grade 3 to me. So this quantifies the appearance or aggressiveness of the cancer cells as they appear under the microscope. The more normal appearing, the less aggressive. And then if they're actively dividing, it's grade 3. And I'm just gonna show you on my report here, these numbers here we're going to talk about the hormone in a second, the estrogen receptor, progesterone receptor, and HER2 receptors. Those are the hormone receptors, and you see that mine are 0% on all of those, which means that it is triple negative breast cancer. And this 100%, that means the cells were actively dividing, and 90% actively dividing. And so that, bringing us back here, tells us that it's a grade 3. And again, ER was negative, PR was negative. That's for receptors for estrogen or progesterone. And the HER2 was also negative on my pathology. And for clinical, she's calling it a stage 3 due to the size of the tumor, the lymph node involvement, and the fact that it's triple negative. So the other things that this does talk about is surgical options. And of course, because I was meeting with the surgeon, she did talk about the plan based on the fact that there was this small area, one tumor that we knew of at that point, and possible lymph node involvement. She was still really kind of optimistic that we could do a partial mastectomy or breast conserving surgery or breast reduction surgery in conjunction with a plastic surgeon. This would be on both sides, even though all of my cancer was on the left side. My right side was totally clear. So she said that she's, again, confident that we can do a breast reduction as opposed to a mastectomy, and just based on the size. But of course, there were other diagnostic tests that needed to be done before we could make that final determination. But there are obviously other options, and it talks about lymph node surgery as well. But the way that they treat triple negative breast cancer at this point, I'll just go to the end of this section and then turn this around again. Okay, I'm back. So the way that they treat triple negative breast cancer at this point is they do chemo first, and then surgery, and then radiation. This is from the oncologist. This is the plan. So, and the reason for that is that the hope is that the chemo will actually shrink the tumor so that less breast tissue needs to be removed. And it will also shrink the lymph node involvement to a point where they don't actually need to take any lymph nodes out. And so that's the goal with this treatment plan. So where was I? So this was when I was meeting with the surgeon, the surgical oncologist. She is planning to do a partial mastectomy or a breast reduction surgery, but she referred me to the medical oncologist for the chemotherapy first. And so I met with him the very next day, which was the 21st of July. And again, the plan is chemotherapy and then surgery and then radiation. And with chemo, I'm also getting immunotherapy. So, and then the particular chemotherapy that I'm getting is, there's 2 stages. It's 20 weeks total. So the first stage is 12 weeks, once a week with paclitaxel and carboplatin. And the second stage immediately after that is an additional 8 weeks, every other week with adriamycin and Cytoxan. And adriamycin is the one that they call the red devil. So that is the more, the stronger, I don't know if it's necessarily stronger, but it's a more, there are more side effects associated with that usually. And he said mainly it's fatigue. So the goal of this treatment, again, the Keytruda is the immunotherapy that I'm getting with the chemotherapy as well. So that's every 3rd week throughout that 20 weeks. And I think a little bit beyond the 20 weeks as well. I don't remember how many treatments, and I don't have it written down anywhere. So the goal that the medical oncologist kept saying, he probably said it 3 times in that first visit, is that the goal is a complete pathological response, meaning there is no evidence of disease after these treatments. So his, he even said the word cure. He's like, you will not have cancer. Everything's successful. What we fully expect is that you will get through this chemotherapy, you will have your breast surgery, we'll send it to pathology, and it'll come back and there was no cancer. And he said they do tend to still recommend radiation. We'll talk about it then, but the idea is that once we're through all of this, I won't need to worry about a recurrence or anything. Everything will be completely eliminated. So, I mean, it all was very positive. Oh, and he said oral chemotherapy for 6 months to a year after the radiation as well, just to make sure that nothing grows back. But I don't know what the end game exactly will be yet, because we're not there yet. So that's all. So that was on July 21st. I met with a medical oncologist. Now, the rest of it doesn't end there. They don't just start you right away. You have a few more things that you have to go through before you start treatment, and that's some diagnostic, and kind of it helps to make the plan really kind of solidified. So on the 22nd of July, we actually had a vacation planned. So from the 22nd to the 29th, we were away, and they were scheduling appointments and getting insurance approvals and all that stuff. So we were on vacation till the 29th. And then on the 31st, I actually met with a functional medicine doctor. So this is a doctor who's an MD. He was in the system for a long time and then left the system because he felt that he could do more for people's health, treating them outside of the parameters that are, set up by the corporate medical establishment and insurance companies and such. So I went to see him just kind of as a second opinion. I also do see a naturopath and a chiropractor. I've been seeing my naturopath for probably a little over a year. She's helped me with a lot of things, and I saw her obviously about this as well, and met with this functional medicine doctor, and both of them urged me to do the standard care, the chemotherapy and surgery. They said that they have each had other patients that tried to treat their cancer strictly naturally or with alternative therapies and did not have success. And they feel that they, as complementary providers of alternative therapies, could help to support me through this process and get me out the other side and rebuilt back to my health or better afterward with the cancer gone. And so both of them did recommend that I do the chemotherapy, surgery, possible radiation, but we'll definitely revisit that when we get there and get some support during this process from them. And I do see my naturopath about once a month, and the functional medicine doctor is on standby if I need to go in for some sort of infusion or vitamins or something, just to help mitigate side effects. Right now, so far, hasn't been too bad, but if I do need to do that, I'm in his practice now. So also on the 31st of July, I had genetic counseling with the big hospital. So one of the things that the oncologist recommended was that I do genetic counseling because I do have breast cancer in my family. My grandmother, my maternal grandmother died of breast cancer. So they wanted to do some genetic testing, but I have to do genetic counseling first before insurance will pay for that. So I had that meeting. It was a Zoom call, just kind of going through my family history of like all kinds of health issues. And they talk about, what types of things could be genetic. And then they order, basically after the end of that hour, they order the blood work and insurance approves it because you had this counseling. So I went ahead and did that genetic counseling, and then they ordered the blood work, which was drawn when I went on August 2nd for my PET scan. And so the PET scan is a CAT scan where you have to fast before, you fast the night before, and they inject you with radioactive glucose and put you in the CAT scan machine. And as the cancer starts to feed on the glucose, because cancer feeds on sugar, it lights up in the CAT scan machine. So my PET scan was on August 2nd. It showed the left breast tumor. It showed the left lymph nodes. Several of them were also lighting up. Also, I had my left tonsil became illuminated. And so because of that, I was referred to an ENT. And in my abdomen, there were some areas that were illuminated, which the radiology department said were consistent with a prior CAT scan I had on, or MRI that I had on file for endometriosis. And they were in the same areas apparently, but so they're saying that that's most likely endometriosis, but they recommend an abdominal MRI just to rule out any cancer, but they're not really concerned about it. And just the ENT did take a look at my tonsil with a camera. She touched it. She said she's not concerned that there's any cancer in my tonsil at all. I do have a follow-up with her just to monitor that during chemotherapy and stuff, but she's not recommending any treatment with that. She said tonsils often do light up in a PET scan just because the salivary area is very active. And so it's not uncommon that she'll get a referral for after a PET scan. So that's that. So really there were no big surprises on the PET scan. The next day after that, which was August 3rd, I had my port placed. And the port is here under the skin. And I will show you, I have some documentation here about what a port is. So let me put that video. Let me take a little video of that. Turn the camera. So that's what the port looks like. It's a single lumen port, and it sits under the skin where they can access it with IV treatments, and the catheter goes directly into the blood vessel, and it just stays there, and it's there kind of semi-permanently until we take it out. Great. And so the day after the port was placed, again, that was August 3rd. On August 4th, I had an MRI of my breasts. And so they put you in the MRI machine face down on a table that has little pockets for your boobs to go in. And the MRI showed the left breast tumor again, and one additional tumor in the left breast. So it showed the tumor that I found, the 2 to 3 centimeter one, but there was also an 8 millimeter mass right next to it. And also the left, multiple lymph nodes in the left, and the right side was completely clear. So based on that, the tumor board met after that, which is the all of the oncology department heads or the doctors in the oncology department in this big hospital system. They meet and they review all of the cancer cases that come in, and the tumor board recommended an additional biopsy of that second mass to make sure that if it is cancer, that comes out when I have my surgery as well. And so initially they sent me for an ultrasound biopsy on the 30th of August, but they were not able to actually find that 8 millimeter mass. So I was sent for an MRI guided vacuum assisted biopsy. This was actually happened on September 14th. Don't recommend that test. Oh gosh, it was awful. You have to sit again face down. There's a hard piece of plastic on your sternum holding you there, and they kind of put your boob in between two plates, like mammogram plates, but there's a grid on it so that they can put you in the MRI machine, find where they need to go, put the needles in. They numb you up. I mean, you don't feel that, but you have to stay perfectly still while you go in and out of the MRI machine, and they make sure they're in the right spot, and then they suck out the tissue they want to suck out. That was malignant. There is a marker there now, so that area will also be removed when I have my surgery. So there were 2 tumors in my breast, and I think that the MRI actually said 3 lymph nodes were involved in that left armpit area. And then on August 9th, I had an echocardiogram because of the second phase of chemo where I have the adriamycin, which is a more potentially cardiotoxic chemotherapy. They want to make sure that your heart is good. So I went for an echocardiogram on the 9th, and that actually ended up getting me referred to a cardiac oncologist because there was some slight abnormality. The report said possible hypertrophic cardiomyopathy. And so I was referred to the cardiac oncologist. I saw him on September 18th, and he is sending me for a stress echo, which is an echocardiogram, a stress test, and an MRI. But he said that what he showed me in the echocardiogram, what they were concerned with about there being some inhibited flow during times of exertion. He said it will not affect the treatment. It's a very common condition. He said probably there are a lot of people walking around with that undiagnosed. It never causes any problems. And if I do have that, it's very mild, but we're going to assess it further and just see, if there's anything I need to do, but it's not going to change my course of treatment or delay my treatment in any way. So that was August 9th was that first echocardiogram. And then on August 11th, I had my chemotherapy education class, which is a meeting with a nurse that kind of just goes through the potential side effects to watch for, when to call the doctor, how to clean up after yourself. They want you to use, pretty much like bleach in the bathroom, or if you get bodily fluids anywhere, they want you to clean it up with bleach. And again, it was mainly just going through side effects and trying to put my mind at ease that, a lot of people go through chemo and don't even have side effects, but they want to tell you all of the things to watch for and make sure you understand them before they start this process. So that was on August 11th, and on August 15th was my very first chemotherapy treatment with Keytruda and paclitaxel and carboplatin as the first treatment. So on June 27th, I found my lump. My diagnosis was July 18th, and on August 15th, I had my first treatment. And so they say usually from the diagnosis, their goal is to have everyone in and started on some sort of treatment plan within 30 days. And certainly I was. So that's pretty much, and there was one other referral. They referred me to allergy and immunology just because of my history of autoimmune. So I have an immunologist following my case as well. I meet with her again soon just to talk about any side effects or reactions that I think might be related to the immunotherapy as well, because that was one of my big concerns. So that was, again, pretty much that's my timeline. So if you have any questions, if you're going through this, I'd love to hear your story. Leave it in the comments. And if you have any questions about anything, please feel free to ask. If you feel like this can help somebody who might be facing uncertainty of cancer diagnosis, then please share. It's, really scary. One of the things that I noticed, not everybody might be aware of this, but one of the things I noticed is that as soon as I got my diagnosis, my sweat would smell different. And I think that that's the cortisol from the stress of just having to deal with somebody telling you have cancer. It's certainly pretty life-changing for everybody involved, for our whole family. Everybody had to kind of, take a step back, and we, realize what's important and what do we want to spend our time on when we have time together. So, it's a daunting task, but it's not insurmountable. And again, my thought from the beginning of all of this is I truly believe that we sign up for this life, and this is the chapter I'm on right now. I agreed to come here and do this, and if this is, maybe this is part of it, and maybe trying to help other people through this is part of it. So that's my goal, and hope somebody gets something out of this. So again, you can check. I myself am, none of this is medical advice. This is just telling my story. But I myself I tend to be distrustful of doctors. As I mentioned earlier, I've had too many situations where I felt like doctors were had too much tunnel vision and didn't listen to me at all. And again, if you don't feel like you're being heard, then ask to see someone else or go to a different location. A lot of places there is another hospital system that is not too far that I could go to if I wasn't happy where I was. If you're afraid of mammograms, there's thermography now, and that's a good kind of a less invasive, no risk way to check your breasts for abnormalities with the heat signature that it gives off. And then you'll see if you need to get more involved or go for a more invasive test or risky test. Mammograms are not without risk. There is radiation involved in mammograms. So, it's something that I was not planning on doing this time around. I've already had a couple mammograms, but I was going to go for a thermography until I found a lump. And then, now when thermography shows something abnormal, they send you for a mammogram anyway. So now I had to do that because we had to figure out what it was, and it was cancer. So look for changes in your breast as well. One of the other things that we noticed after we really started kind of taking a look is that there was some dimpling or creasing on the side of my breast because the tumor was protruding out with the skin tissue. And I would have probably just attributed that to weight loss, but it wasn't. That's gone now. I will say this, I am 8 weeks into chemo and my tumor is shrinking. So, we're on track. So anyway, this video is getting pretty long. Let me know in the comments what you think, if there's any questions that you have, and we'll talk soon.